Congregate Care in Buffalo, a system under strain. Buffalo's Congregate Care System, designed to support vulnerable populations including individuals with mental health needs, disabilities, and housing insecurity, is facing mounting scrutiny. At the center of this concern is the Buffalo Federation of Neighborhood Centers, BFNC, a nonprofit organization that operates several supportive housing and social service programs across the city. A mixed workplace culture. Employee reviews of BFNC paint a complex picture. Many staff members describe a friendly and supportive environment among peers, with some roles offering flexible schedules and a sense of productivity. However, these positives are often overshadowed by deeper systemic issues. Low pay and minimal benefits. Compensation is consistently reported as below average for the nonprofit sector, with limited health and retirement benefits. Lack of career advancement. Employees cite unclear paths for growth and few opportunities for professional development. Management challenges. Poor communication, lack of transparency, and minimal accountability are recurring themes in staff feedback. Work-life balance struggles. Some workers report being pressured to work off the clock or navigate unclear expectations, contributing to burnout. Unprofessional conduct. Allegations of gossip, favoritism, and workplace toxicity suggest a need for stronger HR oversight. While Buffalo's Congregate Care System is intended to serve as a stabilizing force for individuals with complex needs, a growing body of reports reveals that serious systemic violations may be undermining, not supporting, residents' paths to independence. Patterns of abuse and neglect. Advocates and former residents have documented a disturbing range of practices within some congregate care settings, including violation of court orders, disregarding legal mandates related to housing, guardianship, or treatment plans. Lack of transparency. Residents often report no written leases or house policies, leaving them vulnerable to arbitrary rules and evictions. Signing without payee present. Financial documents are sometimes signed without the legal payee or guardian, raising concerns about informed consent. Financial exploitation. Allegations include misuse of residents' funds, delayed disbursement of personal checks, and coercive control over spending. Eviction threats and punitive measures. Residents may face threats of removal for minor infractions or noncompliance, often without due process. Withholding of mail and benefits. Some programs have been accused of intercepting personal mail, including Social Security checks and legal documents. Denial of off-site housing options. Residents report being discouraged or blocked from pursuing more independent living arrangements. Unreasonable compliance demands. Requirements that exceed legal standards, such as excessive curfews or mandatory participation in non-clinical programs, can feel more punitive than supportive. Family separation. Policies that prohibit children from residing with parents in care settings disproportionately affect single mothers and families. Invasive and unethical practices. These include unauthorized sharing of health information, interference in medical decisions, and manipulation of parental rights. Neglect and psychological harm. Reports of gaslighting, coercion, and emotional abuse suggest a culture of control rather than care. Discriminatory and civil rights violations. Practices that disproportionately impact people with disabilities, people of color, or LGBTQ+ residents may violate state and federal protections. Long-term consequences across the housing continuum. These violations don't just harm residents in the moment, they can derail entire housing trajectories. Supportive Housing Program, SHP, and Continuum of Care, COC. Residents exiting congregate care may be flagged as noncompliant or unstable, jeopardizing their eligibility for federally funded housing programs. Group home and independent living placement. Behavioral notes or eviction records from congregate care can follow residents, making it harder to transition to less restrictive environments. Private market housing. Without proper documentation, lease history, or a clean tenant record, individuals face barriers to securing private rentals, even with vouchers or subsidies. A system in urgent need of reform. These patterns point to a systemic failure to uphold basic rights and protections. Without intervention, congregate care risks becoming a pipeline to chronic housing instability rather than a bridge to independence. Advocates are calling for stronger legal oversight and enforcement of tenant rights in congregate settings. resident-centered policies that prioritize autonomy, transparency, and family unity. Clear documentation standards to prevent blacklisting and ensure fair access to future housing. Trauma-informed training for staff to reduce harm and promote dignity. Buffalo's investment in progressive housing models must be matched by a commitment to rooting out harmful practices at every level of care. Only then can the city ensure that its most vulnerable residents are not just housed, but truly supported. Concerns about client care and legal compliance. Beyond internal operations, BFNC faces serious allegations regarding its treatment of clients, particularly those with special needs or disabilities. Reports suggest discrimination against special needs clients. Multiple reviews and first-hand accounts indicate that individuals with disabilities may not receive services in line with New York State's mental hygiene law. Training gaps. Staff often lack adequate education on mental health regulations, disability rights, and housing discrimination laws. Noncompliance with HUD standards. Programs funded through the Supportive Housing Program, SHP, and Continuum of Care may fall short of federal requirements, especially regarding fair housing practices and accessibility. These issues raise red flags about BFNC's compliance with the Office of Mental Health (OMH), state disability laws, and Social Security disability (SSD) protections. A call for oversight and reform. Buffalo's Congregate care system plays a vital role in supporting some of the city's most vulnerable residents. But without proper oversight, training, and accountability, organizations like BFNC risk failing the very communities they aim to serve. Advocates are calling for independent audits of BFNC's programs and practices, mandatory training for staff on mental hygiene law and housing discrimination, clearer career pathways and improved workplace standards, stronger enforcement of OMH and HUD regulations. As Buffalo continues to invest in community care, ensuring ethical, compliant, and compassionate service delivery must remain a top priority.